This video describes a vertical blind DMEK scroll, a phenomenon occasionally noted with pedicle DMEKs. Traditionally, a DMEK punch involves a circular DMEK, which then forms a scroll. Uh, this is a phenomenon also seen with pedicle DMEK, and most of the time, the pedicle will be parallel or in line with the long axis of the scroll, as is shown here, and it is fairly straightforward to load this up into a delivery device such as a modified Straker-Jones tube. Occasionally, however, the DMEK pedicle will not be in the long axis of the scroll, as is shown here, where it appears to be at an oblique angle to the scroll, and as you apply more balanced salt solution, it seems to be almost perpendicular to the long axis of the scroll. When encountered, the simplest solution here is to blow more BSS till the scroll completely unrolls and reforms in the long axis of the pedicle. Once that occurs, it is fairly straightforward to load the graft into the delivery device as usual. Sometimes, as you will see in the next case, sometimes the graft can be rolled fairly tightly in this vertical blind configuration, and therefore requires a fair bit of flushing with balanced salt solution to make the whole graft unscroll. And once it's unscrolled, again the scroll can reform as is shown here, where it's completely unscrolled. It reforms in the long axis of the pedicle. The pedicle DMEK punch is designed in such a way that the tail should flare towards the middle of the graft. It is not clear why this vertical blind scroll forms. Presumably, it is because of tension within the scroll itself. But this is a phenomenon that is not normally noted or of interest when there is no pedicle. Regardless, this oddity can be corrected with a good gust of BSS.